In December 2019, Chinese authorities alerted the World Health Organization to a cluster of pneumonia of unknown origin in Wuhan City. What started as a mystery disease quickly ravaged the world, with leaders scrambling to keep up. The following report takes a look at the timeline of COVID-19 3 years on.
On the 1st of January 2020, Chinese officials closed the Huanan food market as it was suspected to be the source of the strange new virus. By January the 11th, Thailand became the first country to have reported an imported case of the new virus. This followed South Africa, after which the WHO confirmed human transmission of the virus.
The vast majority of cases outside China have a travel history to Wuhan.
By January the 27th, the total number of confirmed cases worldwide had risen to 4,580. Alarmingly, 2 days later, the global figure had increased to 6,000, and African leaders began to prepare for a potential spread of the virus. On January the 30th, 2020, WHO Director General Tedros Ghebreyesus declared the 2019 virus outbreak as a public health emergency of international concern.
For all of these reasons, I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
On the 11th of February, the WHO assigned the disease its official name.
We now have a name for the disease, and it is COVID-19.
By February the 19th, the death toll from COVID-19 had surpassed 2,000. On the 22nd of the same month, WHO conducted a survey of African countries to assess their readiness for the outbreak and found the region about 66% ready. On the 25th of February 2020, Algeria became the first North African country to record a case of COVID-19, and on the 27th, Nigeria recorded our first case as the first sub-Saharan country.
We are here today to announce the presence of the first case of coronavirus disease confirmed in Nigeria.
On March the 11th, the WHO declared COVID-19 a pandemic. By the 19th, global cases had surpassed 200,000. 3 days later, global cases of the virus surpassed 300,000.
All countries can still change the course of this pandemic.
By the 2nd of April, global cases had surpassed 1 million, with most countries on lockdown. With over 7 million cases globally as of the 7th of June, Nigeria recorded a total number of 25,694 confirmed cases in the month, with a total death toll of 590. Marking the peak of Nigeria's first wave. Due to the significant decline of cases from July to November, there was a relaxation of the lockdowns and reopening of the economy to prevent the second phase of economic meltdown due to the virus. The isolation centers in most states were partially closed, and the country relaxed the usage of face masks in public spaces.
The government of Nigeria, through the Federal Ministry of Health,
on the 10th of December, Nigeria's Health Minister, Dr. Osage Ehanire, said the second wave was imminent because of the rising number of cases, adding that the rise in cases were mostly driven by an increase in infections within communities and, to a lesser extent, travelers entering Nigeria. The milestone of 100,000 confirmed cases was reached on the 10th of January 2021. With Nigeria's first case of the B117 variant confirmed on the 25th of January. The second wave peaked in February and gave way to the third wave, which peaked in August. Although the first vaccine against COVID-19 was administered in 2020, Nigeria received the first batch of vaccines on the 2nd of March 2021. As of 28th of February 2022, close to 18 million people have received their first dose of the COVID-19 vaccine, while more than 8 million people are said to have received their second dose.